This is going to be a position to stretch your hip as well as create a little bit of isometric muscle control through some rotation. So I'm going to do this lying on my back, and I'm going to take one leg across the other with my ankle just above my knee. Now I want to start off just going through some active motion. So I want to do my best to keep my pelvis still so that my lower back and my pelvis stay kind of fixed to the table. So I just want to see how it feels first to rock my knee out to the side and rock my knee across. All right, so if I get any pain at either end point, I'm going to go just to where I start to feel a little discomfort, and then I'm going to go the other way. So this is me just actively moving my hip through some rotation without a lot of excessive pressure on it. Now, if I get to the end of these motions and it doesn't hurt at all, and there's no discomfort, I can give myself a little bit of overpressure, so I get a little added tension at the end of this external rotation, and then I'll come across with my opposite hand to give myself a little bit of added tension into more of an internally rotated cross-body position. I want to watch as I do both of these that my pelvis isn't moving. So I just want to do my best as I push on this knee. I may have my other hand kind of watching my pelvis on this side to make sure it doesn't move. And especially as I come across here, same thing. I don't want my whole butt cheek and whole lower back to rotate. So I just want to go as far as my hip can go without anything above really moving. Now if that's fine, the other thing I like to do is do a little bit of isometric muscle control in these positions. So I'm going to come out to where I start to feel maybe the beginning of tension. If there's pain, I'm going to back off just short of it, and I'm going to lightly press my knee into my hand to feel like I'm tensing in the front of my hip. I'll hold for 3 to 5 seconds, and then I'll switch. I'll bring my knee across. Same thing, just short of pain or a lot of tightness. So if this is a little uncomfortable, I'll back off a little bit. My fingers are going to loop around my knee, and my knee is going to push lightly out into my hand for me to feel like I'm tensing the back corner of my hip. I'm not doing it really hard, so it's not something where harder is better. I just want to see if I can lightly engage a little bit of muscle control without feeling like I'm provoking any discomfort, and without feeling like I'm pushing so hard that I'm tensing in my back or moving elsewhere. So I like this progression of first just light active motion. If it doesn't feel too bad, a little bit of overpressure at each end. And if that's okay, adding a little bit of isometric, knee pushing against my hand this way. And then this way my knee is pushing out to the side into my fingertips.